And welcome back to the show. Well, September is Suicide Prevention Month, and as year two of the COVID-19 pandemic continues, the Delta variant still remains strong, stress levels remain at a concerning high, and many populations, new populations, including children and people who have got the virus before, are now being affected. Our next guest is here to provide some information to help somebody dealing and struggling with depression. Joining us to share more details is the Associate Director of VNSNY Community Mental Health Services, Deirdré DeLeo. And thank you so much for being with us.
Thank you so much for having me, Darren. I always appreciate the opportunity to speak about these important issues.
And it is an important issue because when we talk about where we are right now, many people didn't anticipate we would be 2 years into this pandemic, but yet and still the COVID variant, the COVID virus and the variant continues to wreak havoc across New York and the United States. And we're finding more and more people actually dealing with depression. Share with me a little bit more about those thoughts that people are having during this time.
Sure. I'm sure a lot of people like myself thought that the pandemic would be behind us. We're now dealing with another variant, which people are getting despite having vaccinations. Parents are worried about what's going to happen in September. Children are going back to school. Children are worried they have to adjust. Some children did a whole year last year remotely. Now they're faced with going back 100% full time. And it's causing a lot of anxiety, a lot of stress. People are worried about catching COVID again because people who've had it may be reinfected. And there's just a lot of stuff that's, I'm going to say, up in the air for everyone right now. And a lot of stress, it has a huge toll on our emotional well-being.
Yeah. And when you talk about that toll on the emotional level, some people take it to the most gravest form, and that is of suicide. As we continue to hear more and more accounts of people actually taking their lives. And I know that, when we talk about suicide, we want to make sure that our viewers are pretty much well aware of suicide and the rise, and then also how to really be guarded. So let's talk first about suicide and what you're hearing about that.
Sure. There was a study published in 2020 by the CDC, which is very alarming to me, in that 1 out of every 4 young adults they looked at a period of 30 days, had considered suicide. That's a lot of people thinking about suicide. And right now, it's the 11th leading cause in the United States of all populations. It's the second leading cause of our children aged 15 to 24. And there's more recently been studies shown that Black children between the ages of 5 to 11, the rates of completed suicide are rapidly rising for that particular population. So it's really something that everybody needs to think about, ask about, be aware of, because it is preventable.
Yeah, it is preventable. And I think that sometimes we overlook the most common things, signs that people are exhibiting during times when they're depressed and their emotional mood swings are going south. But for somebody who may be watching right now, make us more familiar with what are some of the signs that particularly we maybe need to pay attention to when it comes to the issue of suicide.
Sure. The number one predictor of suicidal ideation is actually people expressing hopelessness. So nothing's going to get better. They're just really down in the dumps, as we say, right? You're looking for people who are saying that people would be better off without them. They can't do anything right. They're expressing thoughts of being worthless. You've noticed a change in the way that they behave. So someone who's very outgoing, all of a sudden they're very to themselves. And I know, as I said before, during the pandemic, it's a little harder to see that because we're a little more isolated anyway. But someone who maybe would reach out by text or email or phone calls, now you're not hearing from them at all. Something that some people do is they start giving their things away, or they start talking about, I want to leave that to you. Maybe sleeping more, sleeping less, changes in appetite, eating more, eating less, losing a lot of weight, gaining a lot of weight, just really marked change from how that person usually is. And those are the signs to really look out for.
Yeah. And then you have these signs that are verbal and then nonverbal. And I know your organization does a great job of really dealing with people and helping families and individuals be able to deal with that. So from your perspective, share some of the services that are available to people who may be seeking assistance.
Sure. So VNSNY has a very robust community mental health department. We have a clinic for children and their families in the Bronx, and we have a lot of home-based services that we do. And the one that I really would love to talk about, because it ties so neatly in with suicide, is our mobile crisis teams. So mobile crisis teams are a service that are funded throughout the city by New York City Department of Health and Mental Hygiene. And they're for anyone, birth and up, who's experiencing any kind of emotional crisis. And maybe they're not willing to reach out for help, or they're having a hard time finding help. And all the services are accessed through NYC Well. And that number is 1-888-692-9355. And NYC Well clinicians, and they are all mental health clinicians, will ask questions, and you can call for yourself or you can call for someone that you know. And if they determine that the person is at risk, they will make a mobile crisis referral. And our mobile crisis teams consist of clinicians and peer advocates, and we go out and we do home visits. And I just also want to highlight that there are two types of mobile crisis teams. We have teams that are specifically geared for children and young adults. And then we have the adult teams, which will see everyone from ages 21 and older. And we do see a lot of seniors, because a lot of seniors are more isolated and having a lot more issues with depression lately. The teams will go out, they do a full assessment. If the person would benefit from being seen in an emergency room, we get them to the emergency room. And if they would benefit from staying in their home and getting connected in the community, we stay with them through phone calls, additional home visits, until they get an appointment with a mental health provider.
How impactful have you found it to have that mobile unit? I mean, many times we rely on people coming to us, but yet and still, your mobile unit really reaches out to them. Talk about that impact.
Sure. You know, there are a lot of people who don't realize that they are in a bad place. Sometimes it takes somebody else from outside saying, hey, I'm worried about you. And it's not always an easy conversation for families to have. So having clinicians come to the home, we do make appointments when we can, and it's a lot safer to talk to someone, much like you're talking to me now in my living room, right? In a way, you've done a home visit to me. It's just, you're more comfortable, you're in your own environment. There's less stigma around someone coming to you than you walking into a brick and mortar building. So in a way, it's a nice way to get connected.
Yeah. And with COVID-19 really being still at the forefront of many people's minds, I know a lot of people have a lot of issues about going outside, but yet and still your volunteers are going door to door, really making that impact.
Yes, our staff are going and making home visits despite everything. We wear all the approved CDC PPE. Everything is done safely. We're, maintaining social distance in people's homes. If someone says, I'm really, really concerned about COVID and I don't want you to come to my home, then we will do everything that we can telephonically. So we want everyone to be safe and we want people to be comfortable.
Yeah. Have you seen an increase since we've been talking about the COVID-19 pandemic of more calls, more people going out with your mobile unit?
It has been getting busier in the last month or so, probably because people are a little bit more stressed because of the school year starting. So it is making people a little bit more anxious.
Yeah. Well, Deirdré, I want to thank you so much for being with us and sharing a little bit about suicide prevention. Again, great work that you're doing in the community, especially at a time like this. Many people dealing with emotional health and their psychological and mental well-being, but VNSNY out there at the forefront. Thanks so much for joining us.
Thanks so much, Darren. We really appreciate you allowing us this time to talk about this topic and about the services that VNSNY provides. Thank you.
Definitely got to have you back, and want to let our viewers know, if you want more information, please do us a favor. Visit their website, vnsny.org. Also, you are more than welcome to utilize your phone and give them a call. Their number is 1-800-675-0391. Again, that number, 1-800-675-0391. Now, we do have more show for you. We encourage you, don't go anywhere. Open will continue coming up after this break.